Good morning. Has your morning firmness faded after 60? Do you wish there was a natural way to jumpstart your day and your confidence before you even set foot on the floor? What if the answer wasn't found in pills, pumps, or expensive treatments, but in 3 simple pressure points you can press while still lying in bed, right after waking before standing up, that could support stronger blood flow, steadier nerves, and more consistent morning erections? The truth is that tiny changes in those first moments after your eyes open can make a profound difference in circulation, mood, and male confidence throughout the entire day. Right now, you're about to discover 3 specific wake-up points that men over 60 are using to naturally restore what time has taken away, and you can start trying them tomorrow morning without ever leaving your bed. If this sounds like something you need, go ahead and like this video, comment with your age and country, and subscribe for natural senior health fixes that actually work. Here's why those first moments after waking matter so profoundly for men over 60 and why understanding this changes everything about how you start your day. Overnight, your blood flow naturally slows down as your body enters deep rest and recovery mode. Your nervous system shifts into a parasympathetic state where repair happens, but circulation to extremities, including the pelvic region, reduces significantly. Your hormone production, particularly testosterone, follows natural cycles that peak in early morning hours, which is why younger men experience spontaneous morning erections without any effort or thought. This is your body's natural waking rhythm trying to work the way it's designed to. But after 60, several things change that interrupt this natural pattern. Blood vessels become less flexible and responsive to nerve signals. The smooth muscle tissue in the erectile chambers becomes stiffer and less elastic. Nerve pathways that once automatically triggered morning firmness become less sensitive and require more deliberate activation. Your body still wants to function the way it used to. All the systems are still intact, but they need a gentle wake-up call to remember their job. That wake-up call can come from simple, intentional pressure applied to 3 specific points that activate nerve clusters, encourage blood flow, and signal to your entire system that it's time to come alive. This isn't wishful thinking or pseudoscience. It's based on traditional acupressure principles documented in peer-reviewed studies from 2020 through 2025, showing improved erectile function through targeted pressure point stimulation, physical therapy techniques used by pelvic floor specialists, and evidence-based understanding of how nerve pathways and vascular response work together. When you press these points correctly, you're essentially flipping switches that tell your nervous system to redirect blood flow, relax smooth muscle tissue, and prepare your body for the demands of the waking day. So where do men over 60 typically go wrong with their morning routine, and why does understanding these mistakes help you avoid them? Many rush out of bed the moment they wake, jumping immediately into vertical position without giving their body time to adjust or activate. This sudden shift from horizontal to vertical causes blood to pool in the legs and away from the pelvic region, undermining the natural hormonal advantage of those early morning hours. Many ignore the body's incredible ability to wake up through intentional touch and movement, thinking that firmness either happens automatically or doesn't happen at all, without realizing that gentle stimulation can activate pathways that have simply gone dormant. Many assume that because they're older, morning erections are simply gone forever and there's nothing to be done without medication, when the reality is that the nerve pathways and vascular systems are still there. They just need deliberate encouragement to function. Many try stimulation techniques that are too aggressive or too rushed, overwhelming the nervous system instead of gently guiding it back online. And many give up after 1 or 2 attempts without recognizing that consistency over a week or 2 is what retrains the body's natural responses and builds reliable patterns. But here's what changes everything once you understand it: the exact how-to instructions for 3 specific wake-up points, why each one works based on nerve clusters and blood flow patterns, and how to blend them together in a simple sequence that takes less than 3 minutes while you're still lying comfortably in bed. Let me walk you through the sensation and exact locations of the 3 wake-up points and visualize this so you can try it confidently tomorrow morning. The first point is located at the soft tissue between your thumb and forefinger on either hand. This area is called the Hegu point in traditional acupressure, and it's associated with activating circulation and nervous system responsiveness throughout the entire body. To find it, open your hand and spread your fingers slightly apart. You'll notice a fleshy mound of tissue between the base of your thumb and the base of your index finger. Press gently into the center of that mound with the thumb of your opposite hand, applying steady, firm pressure. Not painful, but enough that you feel a dull, spreading sensation. Hold this pressure for about 30 seconds, breathing slowly and deeply as you do. You might notice a slight warmth or tingling sensation spreading through your hand and up your arm. That's the nerve pathways responding to the stimulation. Release the pressure slowly, then switch hands and repeat on the other side. This first point supports overall circulation and signals to your nervous system that it's time to wake up and become responsive. The second wake-up point is located on the inner thigh, about 2 to 3 finger widths above the knee on the inner side of your leg. This area corresponds to the spleen 6 acupressure point, which is traditionally associated with blood flow to the lower body and pelvic region. To locate it precisely, sit or lie with your legs slightly apart and relaxed. Place your hand on the inside of your knee, then move 3 finger widths up toward your hip along the inner thigh. You'll feel a slight indentation or softer area between the muscles. That's where you want to apply pressure. Use your thumb or the pads of your fingers to press gently but firmly into this area, holding steady pressure for about 45 seconds to 1 minute. You might feel a dull ache or a spreading warmth in the area. That's normal and indicates you've found the right spot. Breathe slowly and deliberately as you hold the pressure, allowing your body to relax into the sensation rather than tensing against it. This point directly supports blood flow to the pelvic region and helps activate the nerve pathways that control erectile function. By stimulating this area while you're still lying down, you're encouraging blood to flow toward the pelvis rather than away from it, which is exactly what you want for stronger morning erections. The third wake-up point is located at the lower abdomen, about 2 to 3 finger widths below your navel in the center of your body. This area corresponds to the conception vessel 4-point in traditional acupressure, and it's directly associated with reproductive energy, pelvic circulation, and sexual vitality. To find it, lie on your back with your knees slightly bent for comfort. Place your hand flat on your lower abdomen with your fingers pointing downward toward your pelvis. Move your hand down from your navel until you're about 3 finger widths below it, right in the center of your body. Press gently into this area with the pads of 2 or 3 fingers, applying steady, comfortable pressure. You're not pressing hard enough to cause discomfort, but enough that you feel the pressure penetrating into the lower abdomen. Hold this pressure for about 1 minute, breathing deeply and slowly into your belly as you press. You might notice a warmth spreading through your lower abdomen and into your pelvic region. That's the increase in blood flow and nerve activation happening in real time. This point is particularly powerful for men over 60 because it directly stimulates the area where reproductive organs, major blood vessels, and nerve pathways converge. Here's how this sequence supports nerve signaling, local blood flow, and sends a recovery cue to your body that often translates to firmer, more reliable morning results, When you press these 3 points in sequence, you're creating a cascade of responses throughout your nervous system and vascular system that work together synergistically. The first point between the thumb and forefinger activates your body's general circulation and wakes up the autonomic nervous system that controls automatic functions like blood flow and arousal. The second point on the inner thigh redirects blood flow specifically toward the pelvic region and activates nerve pathways that control erectile function. The third point on the lower abdomen directly stimulates the area where erectile tissue, major arteries, and reproductive organs are located, encouraging immediate local blood flow and smooth muscle relaxation. Together, these 3 points create a triangle of activation that tells your entire system it's time to come alive and function the way it's designed to. This should never hurt. Comfort and warmth are the key markers that you're doing it correctly. Now let me walk you through tonight's preparation so you're ready to try this tomorrow morning with confidence. Before you go to bed tonight, take a few minutes to familiarize yourself with the locations of these 3 points while you're lying down comfortably. Find the soft tissue between your thumb and forefinger on one hand and press gently to get a sense of where it is and what comfortable pressure feels like. Then locate the spot on your inner thigh about 3 finger widths above your knee. Press gently and notice the slight indentation where the muscles separate. Finally, place your hand on your lower abdomen and find the area about 3 finger widths below your navel, pressing gently to feel the tissue beneath. Set your intention tonight that tomorrow morning, before you stand up, you're going to take 3 minutes to press these 3 points in sequence and notice what happens. Commit to quietly scanning your body's response for at least 7 mornings before deciding whether this technique works for you, because consistency is what retrains dormant nerve pathways and establishes new patterns. Here's what you need to know about the science and safety behind this approach. These wake-up points are based on traditional acupressure principles that have been used for thousands of years to support circulation, nerve function, and sexual vitality. Modern physical therapy and rehabilitation science supports the idea that targeted pressure on specific nerve clusters can activate reflex pathways and redirect blood flow to areas that need it. However, this technique is not a replacement for medical care, diagnosis, or treatment of any condition. If you have diagnosed medical conditions like diabetes, neuropathy, peripheral vascular disease, or any condition that affects circulation or nerve function, you need to check with your doctor before trying this technique. Signs to stop immediately include sharp pain, numbness that doesn't resolve after releasing pressure, severe discomfort in the abdomen or pelvic region, or any feeling that something is wrong. Normal responses include warmth, tingling, a dull spreading sensation, and increased awareness in the area. Let me address some questions that naturally come up when men learn about this technique. Does it work right away, or does it take time to see results? Most men notice some response within the first 3 to 5 days, often a subtle increase in morning awareness, or a slight improvement in firmness. But the full effect builds over 1 to 2 weeks as your nervous system relearns the pattern. What if you don't feel anything when you press these points? Start with lighter pressure and gradually increase until you feel a dull, spreading sensation. Is more pressure better? Absolutely not. Gentle, sustained pressure is far more effective than aggressive pushing. Can you use this technique for other issues like low energy? Many men report secondary benefits like better overall energy and improved mood. Is it okay to stand up right after finishing the sequence? It's better to remain lying down for another minute or 2, allowing your body to integrate the stimulation before standing. Who should skip this technique entirely? Men with acute pain, recent surgery, blood clotting disorders, or any condition where touch or pressure could cause harm. Does the order of the 3 points matter? The sequence described is designed to progressively activate circulation from general to specific, but experimenting with different orders is fine. How long before most men see a noticeable difference? Most report meaningful improvement within 2 weeks of daily practice. Now, let me walk you through what to observe over the first 7 mornings, and then what to expect by 14 days of consistent practice. For the first 7 mornings, pay attention to whether morning firmness is present at all when you wake up, even if it's subtle or partial. Notice whether the firmness feels stronger, fuller, or more sustained than it did before you started this technique. Observe whether you feel more aware of sensations in the pelvic region throughout the morning. Track whether your overall energy in the first hour after waking feels clearer, more stable, or more confident. By day 7, most men notice at least 1 or 2 of these shifts beginning to happen consistently. By 14 days, these changes should feel more integrated and reliable. Morning erections that were inconsistent should now be happening most days with noticeable firmness and duration. Your overall confidence in your body's capability should have improved meaningfully. If you're noticing shifts by day 14, comment below with your age, country, and what the first week or 2 felt like. Whether it's better firmness, more consistent mornings, improved confidence, or simply feeling like your body is working with you instead of against you. So here's what happens next. In the comments below, share your age, country, and whether you're going to try this 3-point technique tomorrow morning before getting out of bed. Make it a public commitment that keeps you accountable. If this information made sense and you want more practical, evidence-based guidance on natural ways to support male vitality, circulation, and confidence after 60, subscribe to the channel right now. It's never too late for smarter, gentler routines to support your health, and this one can start tomorrow morning before you even put your feet on the floor. You don't have to accept decline as inevitable. 3 simple pressure points, 3 minutes of your time, and 14 days of consistency might be all it takes to restore what you thought was gone. The transformation starts tomorrow morning.